200, 200 are there. So let's go, guys. Let's start. Yep.
Should I start?
Yes, Aisa, please go ahead.
Okay. So, good evening, everyone. Um, Thank you for joining today. Uh, as Samriddhi ma'am has already shared a few of the points in the WhatsApp group, so please keep those in the mind. So, let us start the session today. On the behalf of CliMed Academy and the Heart Health India Foundation, it is my honor to welcome you all to Cardiology Summit and Crash Course 2024, held in recognition of World Health Day. This event is a unique platform to deepen our understanding and refine our skills in managing acute cardiac emergencies, with cardiovascular diseases continuing to be a leading cause of mortality worldwide. The need of advanced knowledge and immediate response in such critical cases has never been greater. We have all gathered here some of our brightest minds in the cardiology, emergency medicine, and critical care, all coming together to share your expertise, research, and latest innovation in the field. This summit is designed to provide comprehensive and uh, great insights on the range of essential topics, including one, the approach to the chest pain in emergency situations, acute dyspnea, diagnosis and treatment, managing a hypertensive crisis, handling acute heart failure, tackling acute pulmonary embolism, the management of acute aortic dissection, the crucial role of clinical pharmacists in cardiac emergencies, and counseling tips for cardiovascular patients in caregivers. Participants will receive a course certificate along with 2 credit points for this educational journey. As you immerse yourself into this discussion, let this summit inspire new perspectives and practices that could transform the way we care for patients with cardiac emergencies. I encourage everyone to actively engage in our esteemed speakers and colleagues, fostering collaborations and innovations in our shared missions to improve heart health outcomes. Thank you for being part of this vital initiative. Together, let's continue advancing the field of cardiac emergencies and management for the betterment of our patients and communities. Please join me in welcoming our director. It's my privilege to introduce Dr. M. Sudhakar Rao, a consultant cardiologist at Manipal Hospitals, Bangalore, and associate professor at Kasturba Medical College, Manipal, with over 10,000 coronary angiograms and 5,000 angioplasties to his names. Dr. Rao is the recognized expert in interventional cardiology, specializing in IVUS guided PCI and complex coronary interventions. A fellow of American College of Cardiology and Educational Society of Cardiology, Dr. Rao is also a dedicated educator and researcher shaping the future of cardiology. As we gather here today for the Cardiology Summit in collaboration with the Heart Health India Foundation, please join me in welcoming Dr. M. Sudhakar Rao, who will share his expertise on managing cardiac emergencies. We welcome you, sir.
Yeah, thank you. So thank you, Aisa. So I won't take much time. Thank you, Dr. Ajit.
By your video. Yes.
Thank you, Dr. Ajit, for your collaboration. We thought of doing this on World Heart Day, but being a Sunday and people may have their other commitments, our friends. So we thought we'll do a week before this. And we chose the topic cardiac emergencies because most of the people who have joined here, they will encounter this cardiac emergencies, various topics at some point of time in their clinical practice. And no other good topic in the field of cardiology than the cardiac emergencies. And I even thank all my colleagues who have joined us on this Sunday. It's not very easy to get speakers on a Sunday. People are not ready to give their Sunday, but I thank all of the speakers, my friends, Dr. Niharika, Dr. Sujalakshmi, Dr. Raghavendra, Dr. Harsa, Dr. Anjana, Mr. Said, and Mr. Ram Khandelwal from Heart Failure Foundation, who has also helped us and helps us in collaborating at this time. So this basically cardiac emergencies are nothing where we see a lot of patients in emergency, and that is why most of our speakers are from the emergency and critical care who manage cardiac emergencies. We as a cardiologist come only after they see the patient and they do the initial assessment. So cardiac emergency is all about managing an acute patient, stabilizing him, treating him, and making sure that the patient goes home at the best of the condition. So today we have some of the topics called the hypertension related to pulmonary embolism, aortic dissection, how we approach a dyspnea patient, how we approach a patient with chest pain in an emergency. So without taking much time, I think I hand over to Ajit to speak a few words on this about the cardiac emergency before we start this session.
Yes. So thank you. First of all, thank you everyone. We got around 700 plus registrations for this course. And as Dr. Sudhakar has told, this is a wonderful opportunity at the on the occasion of the World Heart Day 2024. That is next week on 29th. But again, that's on Sunday, so we could have planned it earlier because on that day everyone is busy and everyone has their own plans. The conferences, workshops, and also today we are gathered here with all our esteemed colleagues who are working in the emergency medicine and in the cardiology to present on these things. So when I'll come to the a little bit of this course making. I and Dr. Sudhakar Bhai was talking about like, let's do something on that. So he was like, let's do some cardiology summit or cardiology conference. I told no, because we are covering the almost all the educational academic topics of management of cardiac emergencies. So let's make it a crash course also for the students, which can help them getting credits and we can help them, getting all the information on the cardiac emergencies management. So that's how we came up with this management of cardiac emergencies and cardiology summit and crash course. So today we have with us, Heart Health India Foundation, led by Mr. Ram Khandelwal. So he has helped us a lot. He has, with his help, we are, conducting this. And we have our educational partner also, led by Dr. Sudhakar, that is cardio blogger. He's running the website, his Instagram page, and very enthusiastic and proactive in the cardio, awareness, cardiac emergency awareness, and cardiology awareness teaching. So today we are gathered here, and I will also not take much time, but I would like to tell you guys, this is a wonderful opportunity for all the students and all the PG, UG, pharmacy, healthcare, or cardiovascular technology students who are working in, because you are going to get the comprehensive coverage on cardiac emergencies, starting from approaches to the chest pain in emergency, and then patients with the acute dyspnea in emergency, hypertensive emergencies, hypertensive crisis, management of acute heart failure, management of acute pulmonary embolism, acute aortic dissections, and all other cardiac emergencies. Along with that, to my fellow friends here and from the other healthcare uh, streams like pharmacy, we have two very wonderful sessions like role of clinical pharmacist in cardiac emergencies and patient and caregiver counseling, which I believe is one of the most important part of the treatment, part of the follow-up when the patient goes home, how to take medicines, how to avoid medication non-compliance, and also those things will be covered here. And then we have a wonderful topic, which will be taken by Mr. Ram, role of patients in the patient-centric care and insights from the CVD patients community, because he's running this awareness programs in the entire community. And I would like to thank again Dr. M. Sudhakar Rao, our colleague and my fellow director for this course. Thank you, Bhai, for wonderful course and coming up with this idea. And then we have Dr. Niharika Aneja, we have Dr. Anjana, we have Dr. Suja Lakshmi, Dr. Raghavendra, Dr. M. Harsa, and Mr. Saeed Bhai from Dubai. He's joining us for this. So, guys, as I always tell in my courses and everywhere, I'll not be here for the entire course with you today because I'm outside and I'll be traveling in 2 hours. But as I always tell, please make use of it at fullest. Right now there are 305 people in Zoom, and around 50 people in YouTube right now. So I can see there are 400, 500 people, and definitely by end or in some time we'll be having 500 plus or 700 plus. So it's a great achievement. You guys are giving your time on Sunday, but make best out of it. Ask as many as questions you can ask. Yes, there is a limitation today. You cannot speak, but you can write your questions to the mentor, whoever is teaching, and your questions will be taken up by all the mentors. And that's all from my side, guys. Thank you very much. Thanks to all the professors and friends who are joining here, and thank you all the participants, and thank you, Isa. Thanks to my team, Dr. Samriddhi and Arun. So for taking care, guys, take care and best wishes. And this is not a long thing. Like, you don't have to come every day. This is just 3.5 hours. In 3.5 hours, you are going to learn a lot, right? And a special instruction what I got from my team to tell you guys, you have to be here. If you want the certificate, you have to fill the feedback form versus this feedback attendance form at the at any point of time after half of this course. We are not telling at the end because people usually come at the end and join, but after half of this course, anytime we can share, my team will share the feedback form. If you are willing to get a certificate, you have to be here. If you're not filling, you cannot claim the certificate at the end. You cannot come to me, sir, I just left for those 5 minutes only. I was not there. My network is gone. So if you want the certificate, you have to come and fill the feedback come attendance form. Okay. So we can at least come to know. I mean, your attendance is being taken care, but still you have to fill the feedback form. Okay. So by this, guys, I'll end my talk here. I don't want to rush it more. So thank you very much again. And thank you, everyone. Back to Isa.
Thank you, sir. On the behalf of the entire team, I want to extend our heartfelt gratitude to you for making time and making this summit possible despite your busy schedule and travel commitment. Your dedication to the sharing your expertise and insight is truly inspiring, and thank you for arranging such a wonderful summit. So your contribution at immense value to the summit, and we greatly appreciate your efforts to be with us and even while you're on the move. So thank you so much, Ajit sir. And
Thank you, guys. Please go ahead.
so let us begin with our session one, that is approach to chest pain in the emergency by Dr. Niharika Aneja. Dr. Niharika Aneja is an associate consultant and head of the department in accident and emergency care. She completed her DNB in emergency medicine at Manipal Hospital's Old Airport Road, where she gained extensive training in managing both adult and